Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter F. Today I'm going to talk about a special condition. It's called frontotemporal dementia. It's kind of dementia, but it's not. It's similar as Alzheimer or Lewy body dementia, but there's some difference. So in terms of how to recognize the difference, usually this is really the physician's job to tell you what kind of dementia it is. But for those who had probably with risk of this kind of dementia, or the family member notice of this kind of change even before the memory change or before the dementia developed, so that's probably can recognize early. So what is this frontotemporal dementia? Is any associated emergency situation with disease with this frontotemporal dementia? I think the most I can think of emergency situation is fall, or really this dementia impaired daily function caused some really accident or disasters. Otherwise, the disease itself really, because it's dementia, it's a gradual chronic process. So the disease of this frontotemporal dementia itself is not warrant for the emergency visit. However, the complication of this disease, for example, the disastrous accident or fall, so that kind of emergency situation is associated with this disease. So what is this frontotemporal dementia? So in order to understand that, let's just briefly review the lobes of the brain. We know there's a frontal, there's a parietal, there's a temporal, there's occipital. So it's central, and there's a cerebellum inside of the cerebral structure. So basically, if you probably already know it, the frontal lobe, majority of the major function for each lobe is for the motor or movement function. That's frontal. Parietal is probably sensation, the major function of sensation, and the temporal occipital is vision, hearing. The temporal lobe is responsible for the memory, the emotion, etc. So this and cognitive. So this frontotemporal dementia is really the most prominent characteristic of this dementia is cognitive emotional change before the memory loss, before the dementia developed. And this disease is anegonomic, which means the patient couldn't tell. They could not know it. So only the family member can know it. So for example, what kind of the developed age is also earlier compared to Alzheimer or Lewy body dementia, probably similar as Lewy body dementia, but it's not like 8. Alzheimer, for example, can develop at a late age, but this frontotemporal dementia can occur at 50, start at 50. It's a very subtle process, cognitive change like withdrawal or forget things, but it's very subtle. Especially if for those has pre-existing psychological conditions like depression or anxiety or history of other psychological problems. So this really can mask the dementia itself. So the take-home message, if this really for the family members, if you have elderly around you, I'm not saying everybody is, but if you notice subtle changes, not only the memory, also the personality change, cognitive change, behavior change, on top of the dementia, on top of the memory loss. So how to do that, how to recognize this? Just pay attention, talk them, see whether the conversation can be continuously, or test some basic knowledge about the mini mental status. And if you notice there's some change, for example, really easy to be forgetful at early age, and also you notice personality behavior change. So that probably, I'm not saying it definitely is, probably it is either caused by psychological disease, like dementia can cause, for example, depression can associate with difficult concentration, so difficult to remember things, but it's not dementia. After the depression is treated, the memory function will be recovered. For this frontotemporal lobe dementia, however, you notice the cognitive change, you notice the behavior change, and you treat it, but the dementia is still there. So basically, this is a special form of dementia. If you recall, we talk about Alzheimer's disease is the most common one, and the other like Parkinson's associated dementia, Lewy body dementia, or cerebrovascular associated with post-stroke associated dementia. But this is a special form, usually occurred with those pre-existing psychological or past history of psychological disease might have this kind of dementia. The loss of memory could be caused by the other psychological disease, like I said, anxiety or depression. They all can cause this kind of decrease the memory because of difficult concentration, constantly worry or feel depressed. But like I said, this frontotemporal dementia is not exactly like what I just mentioned, the psychological caused memory loss. So anyway, in terms of treatment, I think it's this frontotemporal dementia is treated with treated dementia at the same time treat the psychological cognitive abnormalities. So that would together to improve the memory, improve the mental status. So taking home message, if you have people, older people around you, pay attention to them and remind them, and also try to decrease the risk of fall, any other kind of accidental disasters. Like if you recall, there's some older people had those kind of risk to cause this kind of problem. And talk to the physician. If you have this kind of concerns about your family member, then physician will probably offer the help and exam, see whether, or you can do a little mini mental test, like I said previously. How to do this? You can search mini mental test, or I can just briefly here give you some hint. You can ask about orientation of the people, the date, the time, the location, the current most important event, or current president, or do the simple math, 100 minus 7, do a 0 abstractions, and or use for objective or recall, you give, show these people 4 things, and later on to ask, do you remember what I showed you? Or backward spell some simple words, for example, the world. Ask a patient, ask people around you, can you spell backward the world, D-L-R-O-W, something like this. So you can tell whether the mental status of patient is intact, plus whether there's any cognitive behavior change. So okay, so this is again, the purpose of this video is really for the family member, because the patient, as I said, they do not recognize it. It's so only the people around them can identify this problem. So if that's the case, then try a little the technique I just mentioned, or pay attention to make sure there is the safety, and also to remind them and to talk to the physician if you have doubt or if you have concerns. Okay, so that is the video for today, and thank you for watching. I will see you next time.